The focus on contraceptive method choice is of fundamental importance to FP 2020. It's about responding to the needs of women and girls, and this is very much at the heart of the FP 2020 movement, of course. We believe at FP 2020 in the right of the individual to decide freely and for themselves whether, when and how many children they decide to have. FP 2020's rights and empowerment principles are clear on the vital importance of method choice. To exercise full, free and informed decision-making, individuals choose among a full range of safe, effective and available methods. Expanding in contraceptive method choice can significantly assist countries in meeting their FP 2020 achievements. For example, in London, on the 11th of July 2017, 19 countries made specific commitments to expand method choice to realise the rights and respond to the needs of women and girls and individuals within their countries. These commitments to expand method choice focused on the introduction of new contraceptive technologies. Secondly, expanding access to existing methods, for example, removing barriers of geography, policy, economic and social barriers which may be there. And thirdly, focused on expanding the provider base. We talk about task shifting and task sharing to bring new cadres of health professionals in to service delivery for particular methods. Research shows that introducing one new method of contraceptives in a country can increase the modern contraceptive prevalence rate by up to 8%. So it's very clear the benefits of doing this for a wide variety of reasons. From my experience in Sierra Leone as an implementer of family planning programs, I understand the complexity of delivering full method choice in the hardest to reach areas of that particular country. It involved the registration of new methods. It involved a robust supply chain and accurate quantification, forecasting of the volumes of commodities that were required. It also involved working on the demand side, so busting those myths and misconceptions that can surround certain methods. And it all came together in a counselling room with informed choice brought about by a two-way conversation between provider and the woman or girl, the client in question, an environment of privacy, confidentiality, dignity and respect. FP 2020 is supporting countries to fulfil their commitments, and FP 2020 as a movement is very much a catalyst to ensure that commitments are operationalised. We're a partnership as FP 2020 of governments, of civil society, of donors, of youth groups, of the private sector and a multitude of other stakeholders in family planning to ensure that countries have the support that they need to deliver on their commitments and make sure they are fully operationalised. Costed implementation plans are a key way in which countries are talking about the implementation of these commitments, how these commitments are realised. And those costed implementation plans frequently feature the expansion of the contraceptive method mix, method choice, and also articulate how those interventions are going to be supported and how they're going to be paid for. And FP 2020 is well involved, significantly involved in costed implementation plans. Increasingly, there are South-South learning exchanges going on as the range of countries across the FP 2020 world who have experience of expanding method choice and can see this in action is increasing. So we're seeing very nice partnerships across countries that perhaps have had in the past a predominance of shorter term or longer term methods and can offer countries within their region expertise on how to really expand that method mix and really be able to deliver the full range of contraceptive methods. We see expanding the contraceptive method mix as one of several interlocking interventions that countries need to invest in order to deliver on their overarching commitments. Of course, this needs to be seen in the context of domestic and increasingly sustainable resources for family planning, of universal health coverage, of robust supply chains, of high quality service delivery and of excellence in the counselling room, as I was saying earlier, to really bring the full range of methods to life so that the client can access the method that they choose.